Okay, so we're moving on to parasites. This is the front page of Moodle, and under parasites, this is a resource, the Parasite Council, and there's also this handout about fecal exams. So when we get to talking about the different types of fecals, I'll refer to that. Parasite protocols, this is just a resource to talk about the common treatment methods, and also, how to clean up and prevent new infections. There is a parasite list. This is a chart, and you might want to fill it out for your own benefit to kind of review and study. I was thinking of posting and doing like another homework through maybe a practice quiz through Moodle, but I might get that posted by tomorrow. I'm not trying to consume your weekend, but it's Thursday. I might be able to get it done later and get it loaded, but I will let you know, since I think people seem to like doing the homework in Moodle like a quiz, without being a quiz.
I think that was really helpful, honestly.
Okay, I seem to get some good feedback. I mean, if you hated it,
because then you get like instant report on what you got, and then you can redo it also. So it's just, that's really, really helpful to me, because sometimes my wrong homework answers will stick in my head because I got them corrected way after I wrote it.
That's a good point. So maybe if we do some more homeworks, and like I said, this chart, this parasite list, it's like an Excel sheet, and you can print it and maybe fill out some of the information, and that might be, when you're doing even vet tech prep later on externship, you could review back to that parasite chart. So, and there's an era of anti-parasitic review pictures, but I'm going to start with the parasite PowerPoint, which is it's going to talk about the common parasites and pictures. So I'm going to be working from this PowerPoint today. So just let me know if you have questions. Let me get this all situated here. There we go. That's what I needed. Okay. So when we talk about the parasites, and they're going to break them down, it's best to try to review them in categories, which the very common category that we think about are the nematodes. Now, phylum is kind of talking about the whole group, nematoda. And so these are all the types of nematodes. So, your ascarids, which are super common, are your roundworms. And then you have the trichostrongyles, but your strongyles are hookworms. And the way I kind of remembered a hookworm is a strongyle. I think about strongyle strangle, or a hook strangles, like if a hook was around something. You guys know I try to come up with weird things to remember things, but I don't know if that helps. Now you have your whipworms, and these threadworms, lungworms, and kidney worms are less common. There recently, I think, was a post on Facebook about a dog that had a kidney removed, and then they pulled out like a giant kidney worm. But when I was talking with Gillis, and I have to admit, I haven't been in general practice in a long time, so parasites are not my wheelhouse, so to speak. But she's like, you put the focus on the more common ones that you're going to see. And then heartworms would be under here as well. So, obviously heartworm is a big deal. So we start with the first section, your ascarids, which are your roundworms. And, anything that starts with the Toxocara is pertaining to the roundworm. And I like, at least it's canis for dog, canine, cati for cat. Now, Toxocaris leonina can be seen in the dog and the cat, but by far you're going to see the most of the canis and the cati. And obviously, what is your fecal sample from? Are you looking at a dog fecal? It's going to be probably canis. If you're looking at a cat, it's going to be cati. And, most clinics will have like a parasite poster. When I went into practice, I brought books with me. So if I looked at something and I'm like, pull out your book. Or, a lot of times your doctor And the clinic is going to have books for reference as well. Now, one that's, we worry about is the Balasascaris prosinois, and it's primarily seen in the raccoon, but can be seen in the dog. And if you notice the little star here, they are zoonotic, so these can spread to people. So the Balasascaris, and the one, well, I'll talk about it in a second. And then Ascaris suum, anything suum, suis, is pertaining to swine. And I used to remember that like I was going to call a pig and go, sui, maybe that helps you remember. I don't know. And then obviously Parascaris equorum, equine, is seen in horses. So if you're getting confused on a test, think about, I always say, try to use any word clue or something in the word that will kind of maybe help you answer the question. Now, the most common, obviously, Toxicura canis. It is located within the small intestine of dogs. Now, it can be transmitted, direct contact with infected feces. It is also spread through the placenta. So, if the mother has it, she's going to spread it to the pups, hence why we always worm pups, right away after they're born, and can be transmammary, so get it through nursing. It can also be indirect. Now, paratinic is kind of like that intermediate host. So, if they eat an infected rodent, a rabbit, or a bird that was carrying it, then they can also infect themselves that way. So you want to be familiar with routes of transmission for the test as well. And this is zoonotic. Now you can get visceral, which would be under the skin, or what we worry about is ocular. So this it can migrate to the eye. And, the larva will migrate. Now, we've got some notes also under here, which are going to be helpful. So, the PPP, does anybody remember what that stands for, PPP? Pre-patent period. So from the time of infection to when, it is detectable, it could be 2 to 4 weeks. Okay, so you do to recheck. I will say what JC's mentioning is interesting. Now, you obviously need to do no fecals or understand it for your board exam. But my boss, like when I was in Chicago a long time ago in general practice, we started doing what's called batch fecals, and we were sending them to the lab. And, my boss was like, yeah, we're going to save money because we didn't have to buy all of the the fecal floats and the little fecal containers, and the pricing, it was going to save us just even a little bit of money. I was thrilled because I'm more efficient if I'm not sitting here looking at 10 fecals. So there are some clinics that will end up sending, fecals out. It's always good, we always kept some stuff in house if we had to do a very quick fecal. And I think Giardia is especially hard to pick up. I'm not really good at finding Giardia myself. And so I definitely would probably be like, can we send it to the lab? So that is an option to do these and send them at the lab. So here's some notes about transmission. The worms lay the eggs. The eggs are passed in the feces. They can be ingested, and then they're going to seed and begin their life cycle. And I don't know, JC, that would be interesting. I don't know too much about that, but I know in Giardia you're usually looking for, you can sometimes find the ova, but I don't know too much about that. Here's some notes down here about indirect transmission. It's the clinical disease, it's very common. It's probably one of the #1 parasites that we screen when they come in for their first puppy exam. Bring a fecal, especially if a puppy is having chronic diarrhea. It's one of the things is like one of the first things you can do is run a fecal. Because if they do have a parasite, sometimes people are like, oh, they're allergic to their food or they don't like their food. And it's like, well, rule out parasites first, because that's very treatable. You could be chasing a dietary problem for quite some time and it not be that. There's some notes here about the, appearance. The big thing is you get the puppies that come in with the pot belly. They have like this little chest and they've got this really big belly. And sometimes if they have a pretty severe burden, they can actually get a poor hair coat because the parasites are taking the nutrients. And so they don't get the shiny coat. They kind of feel unkept. They can get vomiting and definitely loose stool. And anytime you have a puppy with vomiting and loose stool, dehydration can quickly follow. So depending on the size of the puppy, that can be detrimental. Now in Toxicara canis, you can see you've got this very distinct, very thick shell. And, a lot of times when people are first reading fecals, and you guys have done fecals, you're looking at an air bubble, and an air bubble has that dark ring, but it's somewhat refractile. I mean, you can see material inside the egg, and it's a very distinct, very distinct. Now there's a lot, like I said, there's a lot of extra notes in here. Excuse me. Here's another picture. If you look at the difference, not too much difference. Toxicara canis. This, the middle here is kind of shrunken in, but you can still see that very thick shell to the outside. And then Toxicara cati, small intestine, direct transmammary, or again, peritonic host, especially if you have, this is when it's really good when you take a history on a cat. And no matter what I see a cat for, one of the first questions I ask, are they indoor? Are they outdoor? Are they both? Because obviously a cat that can get in the garage or is outside could potentially get into, a mouse, a rat, find a dead bird, So obviously if you've got an indoor cat, unless the person has mice in their house, which is possible, that's a less likely thing. So the pre-patent period is a little bit longer, 8 weeks. Direct transmission is the most common infection. They do not have transplacental. So this isn't going to get passed from the mother like it does in dogs. So again, it's very, very common that it's going to be direct transmission, but it's a lot more common in puppies than it is in kittens. There's newer studies, supposedly, that sorry, that tickle. May not be transmammary like once thought. So obviously direct and a peritonic host are going to be the most common. It is zoonotic, so we still have to worry about the ocular and visceral migrans. And in kittens, very similar. Now, I feel like I see a lot more puppies with pot bellies than I see kittens, but when the kittens get that pot belly appearance, their coat just doesn't feel soft. Their coat just feels kind of rough, just unkept looking. Very indicative of parasites. And, adults, it's going to be a little more rare in adult cats, but, again, they can get the pot belly a little bit unkept. Anytime, I feel like parasites is very easy to rule out. So when you have an animal with diarrhea, usually you can go down a path of dietary, you can go down a path of like other general illnesses, but a fecal is going to kind of cover your base, and then you can rule that out. So, but if you've got the pot belly, the diarrhea, parasites is going to be very high on the list. Now they're about the same appearance, that very thick outer shell, dense inside. And then the Leonina, which your dogs, cats, can be foxes and wolves. So, we had a fox in our neighborhood the other day, like I saw it. So, if you just don't think of them sometimes in our suburbs. Small intestine and direct transmission or a peritonic. So the infective eggs can live 3 to 6. Yes, it will be posted. As soon as I'm done, I'll convert the video and I will post it for anybody that needs it. Peritonic transmission. So again, potential, ingestion or contact with, fox or carcass or something like that you would have to think about. This one again is rarely diagnosed. The difference is it's got that thick toxic hair shell. It's a little more oval than round. And you can see in the middle, the inside, it's like a little more condensed. There's a little more kind of this cytoplasm area around it. Or not cytoplasm because it's not a cell, but if you were, if this is like a cell, it's just a little more condensed. It doesn't go all the way to the edges, and you can see it is a little more oval. Again, this isn't going to be as common, and I'm not going to read all of this underneath, but if you guys open the PowerPoint in notes view, you can get these extra notes, which will be helpful for the life cycle. Now, Balis ascaris prosinois, this is the one of the raccoon, can be seen in dogs, but this is the raccoon roundworm. Think about Balis the raccoon. I don't know. This name, I remember this from 20 plus years ago. Kind of always, they burn this one in our brain to make sure you knew about it. This is in the small intestine, highly, highly, highly zoonotic. So it is direct transmission. The pupating period's a little bit longer, 7 to 10 weeks. So adult raccoons, they will ingest an intermediate host, and that's how they typically get it. Young raccoons, the infested eggs. They can get obstruction or diarrhea in raccoons. That would be what's more commonly seen. Now, the zoonotic things, let me talk about the bottom here. Ocular, visceral, and neural. So this one can go to the brain, the eye, or the skin. And obviously the two we worry about transmission is the eye and the brain is the most critical. And, other wild animals, but we worry about people. Eggs can be infected in 4 to 5 weeks. The big thing here is a lot more people are getting pet raccoons. Personally, someone brought a raccoon in once when I was working at Circle City, and they had found it and they were trying to raise it. I wouldn't touch it. I was like, I'm not touch raccoons. If there's any feces, I'm super paranoid about that. We were technically not even supposed to treat it because we are not a wildlife rehabilitator. Actually, the people that saw the raccoon that night got in trouble from our boss because they were like, we were not supposed to see it. So you can either have someone, I know people can get them now and want to have them as pets, or sometimes people find a baby and then they raise it. Technically, if they are not a wildlife rehabilitator, they're not supposed to have it. And it is can cause very serious issues in people if we get this. So sometimes the raccoons aren't showing clinical signs, and that's the worry. They can be shedding eggs, but not have diarrhea, not be obstructed, and then they could still potentially pass it. So if to decontaminate with this, flame or autoclaving, bleach and other disinfectants do not work. The egg is pretty hardy in the environment. And sometimes and maybe you guys talked about this in large animal, or, maybe you're talking about it now. I know sometimes they'll like flame or burn a pasture. If you've got, some horses, and if they've got a really bad parasites, you know, sometimes just burning the surface of the pasture is going to be the best way to take care of this.
I have a question.
Sure.
If someone ever did deal with like a raccoon or a dog that had this, and they think that they might have gotten some like on their hands or something like that or whatever, like what do they do? They can't really burn their skin off.
Well, you can, if you wash your hands really, really well, you'll be able to like wash them off. It's not gonna.
Oh, okay, yeah.
Yeah.
I guess they can't really stick necessarily.
Yeah.
So
Well. I would just say very good hand washing. And what I worry about, and this is kind of important, because if you've got an animal and they soil their cage and then they leave organic material behind, you've got to get that off, because what they're saying is if you just spray the cleaner on it, it's not necessarily going to kill the egg. It could still be living. Now you could scrape that off. But they're just saying to be absolutely positive, like, on the soil, on a cage, the steam autoclaving, but, a lot of people can't do that. But I have what's interesting, what you could probably do, I have a little pot that I boil water for us to make coffee and tea. And sometimes when I've wanted to clean the counters, I'll pour boiling water on there, let it sit, and then wipe it off with a towel. So boiling water to the cage too would probably be the best bet. It's just that don't get a false sense of security that I'll just spray some stuff on it would kill it, things like that. There's some notes under here about the ocular migrans. Even a small amount of the eggs, they can migrate to the eye and cause damage. The visceral could be, now if there's pica or having a puppy at home. Now, when I worried about this, and I'll give you an example. My neighbors, when my kids were little, and my neighbors when we backed up to woods, and they had a sandbox as part of their swing set, and it was on the ground. And I kind of told them, and then sometimes my kids wanted to go over there, and I was like, your sandbox is kind of like a giant litter box for these animals in the woods. Kids play in the sand. Sometimes kids put, picas eating kind of like dirt or grass or sand. But even if kids play in the sand, then go grab a sandwich and eat a sandwich, then they're if the feces was in there and the eggs. So it doesn't even have to be like eating feces, but if the feces had touched something and, So for me, when I had kids, just personally, I was like, if you had a sandbox outside, you have to make sure it's covered so that they can't get into it and use it like a big litter box. Always wash their hands really well. And the neural larval migrans, it can grow into the brain and to the spinal cord, where it can cause like a formation of a cyst, which can put pressure in the brain. So it is serious. They kind of look like these little more dense. You can almost see like this little squiggle shape in the middle, not kind of like that. You can see the difference in the internal egg structure of the roundworm and this. It's a little bit different. So treating ascarids, I also have a sheet after I talk about this that talks about the drugs and their names, and then we'll kind of go over that after but you can start treatment at 2 to 3 weeks of age, and sometimes in puppies and kittens, they will just do the treatment, won't always check a fecal. So usually the treatment is pretty benign. So you first treat around 2 to 3 weeks, and it always usually probably treat mom as well. But the other thing is you want to make sure, and these will be repeated every 3 to 4 weeks for about 3 treatments. So even though they get the worming at 2 to 3 weeks, it's usually going to be repeated. And, if it's about 3 weeks later, that's usually when puppies and kittens come in for their first exam. And so a lot of times the first puppy kitten exam at a clinic is an exam and a worming. Even if they've had a worming with the breeder, you know, because of the life cycle, they emerge. And this is what I tell owners, because some owners might say, well, they already had a worming at the vet, at their breeder. Well, parasites emerge at different stages at different times. And if you explain that, saying, you know, that worming is going to kill what had emerged at that point, except 3 to 4 weeks later, we're getting the next part of the cycle. So, you know, just in case someone tries to say, yeah, we don't need that, you should. And obviously cleaning well is going to help minimize infection. So, you know, picking up stool in the yard, not leaving stool in the cage, making sure they're not eating stool. So the pyrantel and fenbendazole are very common. Ivermectin treatments, you know, ivermectin is usually a common ingredient, mybomycin. But here are kind of the code words. So your pyrantel, now strongid is going to be very common. Ascarid, strongyle, strongid, that helps you remember. Fenbendazole, which is Panacur, can also do it. And then your HeartGuard Plus. So your ivermectin, like my dogs, I use HeartGuard for their heartworm preventative for Bo and AJ. And the HeartGuard Plus has the ivermectin for heartworm, but it also, they've added the pyrantel. There's HeartGuard and there's HeartGuard Plus. I guess I should say that. If they're on HeartGuard, that's just the ivermectin, which is just for the heartworm. If you do HeartGuard Plus, which has got the pyrantel, it is also doing rounds and hooks. So the funny thing was, and when I had talked to Dr. Ritz about when I got AJ, and I was like, hey, I think I have to get a worming. It's due his next worming. And she's like, but you're also going to start heartworm preventative, and it does have the pyrantel. So it was kind of like killing two birds with one stone. Start heartworm, and it had the worming. So there's various ways to do this. They just, you know, can follow up. And then the mybomycin is the interceptor and sentinel. So I feel like every week, that's an exaggeration, there's new anti-parasitic medication coming out. So got to stay on top of that. Now, Asker is suum, and suum for swine is in the small intestine, direct transmission, and it's the most common nematode in swine. This is zoonotic, so even though it doesn't say that on the slide. Now, thumps, there's a little note under here about talking about thumps. In young swine, it can, when the migrants, you know, a lot of them go through the respiratory tract, go into the lungs, get coughed up, get re-ingested. When it goes through that part of the cycle, it can cause lung lesions, and they can develop pneumonia. And they will get this exudative cough called thumps. So it's kind of a nickname for it. But again, the larvae are migrating through the lungs, coughed up, swallowed, but if they have significant scarring or damage, and then that leads to a secondary pneumonia, this cough, and remember, if something is an exudative cough, is like they're coughing up phlegm. It's, you know, remember exudates are thick type, you know, you got transudates, and something is exudative, it's going to be thick, which is associated with like pus or purulent, greenish type discharge. Lots of neutrophils, inflammation, bacteria. Secondary to this parasitic migration. Also, again, they can get stunted growth and diarrhea. Milk spots, something that can be seen, but this would be on necropsy, or they've been slaughtered, and if it's seen on the liver, and there are fibrotic areas. So fibrosis is like scar tissue, and the liver normally is kind of like a dark maroon, and it's very smooth. So if it has these areas, and this is due to, you know, the migration and the cycle, it can have scarring. Now, the diagnosis they have almost these little bumps. I'm sorry, let me see if this will get a better. The picture, sorry, is not clearing up. And I don't know if it's my computer. So maybe you guys, this will look better, but you know, again, ascarid associated with this thick outer shell, except that look, the mammillated, or like, it's kind of like maybe like these like little slight bumps. So that's a difference. And then a quorum, obviously parascaris quorum in the horse is in the small intestine and direct infection, although this one is not zoonotic. So one that we don't have to necessarily worry about. Direct infection, and it does have tracheal migration. So again, gets coughed up, re-swallowed. That's how it, you know, it seeds and goes through its cycle. The foals are where we're going to worry about, most susceptible, more than the adult horse. Usually somewhere around 6 months. But then once they've been infected, they can actually develop some immunity to this. So ingested by the horse, eggs hatch, migrate from the liver to the lung, and then they can burrow. They can cause some lung scarring. Okay, that's the other issue with these heavy parasitic infections, because as they go to the lung, the higher the burden, the more the more for scarring and damage. They're coughed up, swallowed, and then they can lay the eggs. Eggs are passed. They are infected within 2 to 4 weeks. Pregnant mares should be dewormed to treat for this. And then they treat foals at 8 weeks, every 6 to 8 weeks till they're 2 years old. Keep clean stalls. Try to clean pasture as much as you can, or control, you know, maybe rotating pastures, but sanitation, because the eggs are very resistant even to extreme conditions. They're very sticky. They have a thick coating. There's a note, it can survive up to 10 years in a pasture, even with, you know, say it was a big freeze, and you assume, you know, some of these are going to definitely live. So if you've heard of people burning a pasture, and this is what, you know, now there's control of grasses, that's not what I'm talking about, but, or you talk about rotating pastures, you know, you may only have one pasture for your horses, but if you've got it split, you might treat one pasture and then move the horses and then treat the other pasture, and then keep the stalls as clean as possible. But again, this thick type of egg, pretty round. Now moving on to hookworms, Ancylostoma caninum, Ancylostoma tubiforme in cats, and Ancylostoma brasiliensis. Now your 2 here are going to be your most common. And uncinaria, don't you love saying all these words? Stenocephala. But let's talk about this. So one thing that is seen in hookworms that we have to worry about is cutaneous larval migrans, which is basically migrating under the skin. Sometimes plumbers itch, creeping eruption, but the nematode larvae penetrate the skin, and then they migrate under the skin, which can leave a little tract, which can actually get very itchy and very irritated. So pruritus is just like an inflammation or itchy skin, pruritus. So that's more common in the brasiliensis. So some are going to be more sensitive than others, you know, certain infections not as worse, and can have dermatitis. The caninum can also cause an enteritis in people, which is just an inflammation of the intestine. So again, because of the zoonosis that gets spread, can be a cause of, you know, enteritis. Now this egg, the this is just Ancylostoma species. So right now I'm talking about all of them, not just a specific one. They're all zoonotic. What's interesting is they've got a kind of like this thin, they almost kind of look clear around, and then in the middle you've got these like clusters, almost look, I want to say bubbles is not the right word, but the middle you'll have like these round circles, usually like a gap, and then this thinner, you can see, and it's more of an oval shape, an oval shape. So small intestine, there is direct transmission. They can ingest, so obviously a tracheal migrant, they ingest it. They can, ingest an infected host. So we've got some down here, or direct skin penetration, contact. Transmammary, transplacental are not as common, and then there is cutaneous, which we talked about. Colorless, thin shell, there's some notes under here. Grape-like clusters, that's a way to, like a cluster of grapes here in the middle. And usually more seen, when they're under a year of age, so definitely common in puppies. And can be infected, transmammary transmission through suckling, which that's, going to be a direct transmission. There's a note that when the dog is older, and especially if they've had the infection when they were younger, they're going to be slightly resistant. So it's not a common one that we see in an older dog. The under a year of age is when it's going to be most common. Okay. So if you look at this one here, you can see this oval shape, clusters in the middle. You can see the difference here. I would argue that is a round worm. You can see the difference, the thicker shell. This has got the thin, the clear. Some notes here, clinical signs. Now, one thing about hookworms, and this kind of stayed with me from a long time ago in school, is if you think about the hook or the teeth-like projections, and if they've got a significant burden, these really pull blood. And in severe infections, you can have anemic puppies. So if you have a puppy and they're pale, they have the pot belly appearance, hookworm, especially also what it says here, like the blood and mucus in the stool. That would be all kind of red flags for hookworms. So bloody diarrhea, anemic, if they have a high enough burden, it can cause anemia. And there's some notes about the anemia that's normocytic and normochromic. PCV might be low, so checking that in a puppy. Let's see. Okay, here's tubiforme here, and here's another one. This one, Stenocephala, is actually not zoonotic, even though I know that slide said they're all zoonotic. But you can see they all have that distinct oval appearance, clusters in the middle. The anti-helminths are going to be the medication preferred. So you have, let me get your notes under here. The most common is going to be fenbendazole or Panacur. I feel like every time we had hooks, the Panacur are the packets of granules. They take a packet, can mix it with the food, and I think you repeat it in 3 weeks and sometimes again in 3 weeks. So we usually sold them in like a pack of 3 and had the owner, the owner usually took it home, mixed it with the food, and then repeated and repeated. And again, sometimes you have to explain, I know this is a clinical tip, maybe not a vtne tip, but the owner might be like, well, why are you giving me 3 packets? And it's because of the different cycles. We're killing some now, 3 weeks, 3 weeks. Then you have pyrantel, ivermectin, and some medicines down here. Another thing, anytime we talk about a treatment, obviously I'm talking about medications, but you have to think about environment and sanitation. So removing feces frequently. Now, if there's a lot of sunlight that day, if it's hotter that day, it's going to have some success. You know, freezing will kill it. Some chemicals can kill the larvae. So this one's a little bit easier to kill than some in the environment. But treatment, and here's a note, if you do have a puppy or a kitten that has severe anemia, obviously you're going to have to treat that first, potentially with a blood transfusion if it's bad enough. And then you can't, you're not going to, if they're critical, the you know, obviously you want to kill the parasite, but getting them healthy is going to be first off the bat. Can treat the mother. So a lot of times the mother is treated, you know, as well to hopefully reduce that rate of transmission. I'm going to stop there and pick up at whipworms since we're almost out of time. Do you have any questions?